morning, good afternoon to everyone on the line. Thank you for joining. Can advance to the next slide here. My goal today is to introduce you to the objectives, process, and key priorities identified in the operational research roadmap to simplify Hep B care in low and middle income countries. Hopefully, everyone's had a chance to download and take a look at the report themselves. If you haven't, highly encourage you to do so while I'm speaking so that you can follow along from the report as well. But I hope to hit some of the highlights and introduce those who haven't had a chance to see the report to some of the key themes of the report. Thank you. Next slide, please. So just by way of a very brief background, I think everyone on the line knows the immense burden of hepatitis B globally that we're facing. Over 300 million persons living with chronic Hep B infection globally. And one of the key themes within the epidemiology of hepatitis B is the disproportionate burden of hepatitis B in low and middle income countries. 87%, according to the WHO Global Progress Report in 2021, 87% of the global burden being in the African, South Asian, and Western Pacific regions. Next slide, please. Now, in establishing the elimination goals for 2030, the initial models published in 2016 showed that even with high coverage of prevention measures, including antiviral prophylaxis and Hep B birth dose and primary series for neonates and young infants, there will still be over an estimated 1 million deaths per year from 2040 to 2050. So really a tsunami of morbidity, mortality from hepatitis B globally. And to achieve mortality reductions to the goals of 65% decrease by 2030, the initial models included 80% treatment coverage needed with 95% assumed adherence for linkage to care, treatment, and retention in care. So very ambitious targets and goals, and embedded in those key assumptions of treatment coverage and high levels of adherence that we need to achieve. Next slide, please. I think we all on this call know that we are far from achieving such levels of coverage. Globally, this is the 2021 Global Progress Report from the WHO, showing 10% of all individuals diagnosed and 2% in care or treatment of those needing it. And you can see those numbers are even lower in some of the regions represented by primarily LMICs, including African region and the Southeast Asia region. Advanced slide, please. And we know, and we have the opportunity to hear from our WHO colleagues later on this call regarding the hepatitis B guidelines that will be published very soon. We know that within those guidelines, expanding hepatitis B treatment criteria, simplification of treatment criteria with more people eligible for treatment will actually put additional pressure on already under-resourced health systems and LMICs to achieve target levels of coverage and to ensure that all eligible individuals can actually be linked, initiated on treatment if necessary, and retained in care over time. Next slide, please. So here on the left side is a series of implementation strategies that have been proposed to improve hepatitis B care and have been implemented in certain areas or by certain teams across the care cascade, from diagnosis, assessment, linkage to care, treatment, and adherence and retention in care. And we have strong examples of intervention strategies, not only for hepatitis B, but those that we've learned from the good practice principles for HIV and hepatitis C as well. We do need, for hepatitis B, strong evidence-based models of care delivery that incorporate these implementation strategies specifically for hepatitis B. And the premise of this operational research roadmap is that a benefit of establishing strong evidence-based models is that operational research needed to really demonstrate those evidence-based models of care can facilitate learning while doing, or establishing evidence and demonstrating implementation strategies while actually rolling those out, not waiting decades for the results of long-term trials or studies, but rather learning in real time. And that was one of the key themes that came out during this operational research roadmap process. Next slide, please. So in this report, what we set out to do from the very beginning was conduct key informant interviews and focus groups, then conduct a rapid scoping review of operational research in LMICs, really to identify gaps in the literature, and then conduct an expert workshop, which we held in May of last year, which brought together many of the speakers that you'll hear from today. Next slide, please. So in conducting key informant interviews with 14 operational research leaders across the world, as well as a focus group that was conducted at the APASL meeting in January of last year, we drilled down on research needs that were really expressed by operational research leaders in the field. So community and policymaker awareness were key themes, healthcare provider awareness, training and mentorship, decentralization of services were really required, and integration of Hep B interventions within primary care were identified as a key need within health systems. Of course, enhancements for health information systems and strategic information were listed as a key priority qualitatively from these individuals. In the bottom left, you see here access to diagnostics and medications, including availability and financing or payment for payment schemes for individuals to actually access key commodities, diagnostics and treatment for hepatitis B. Then on the top right here, you see an area around new technologies or the development and validation of point of care, HBV diagnostics, biomarkers, establishing readiness for functional hepatitis B cure, as I think many of our speakers will speak about today. And then finally, an area in the bottom right, which is not as much of a research need, but really a facilitating factor for conducting such research, which will include building capacity for equipment, staffing, training, and data and health information technology systems within LMICs to really ensure that operational research can be conducted. Next slide, please. So a real brief snapshot here on what we learned from our scoping review on operational research in LMICs. We looked at the last 10 years of operational research published in the literature on major literature databases. You can see the detailed methodology on our website. The link is at the bottom left here, but it's easily searchable on our website around the hepatitis B roadmap. But a quick snapshot here of what we learned. We found 56 studies over the past 10 years from LMICs, putting aside literature from China to be analyzed separately. And we found major gaps in the published literature, really describing and evaluating interventions to simplify hepatitis B care specifically. And we found those in screening and assessment to linkage to care, in treatment, in monitoring, and also cross-cutting across training, education, community awareness, availability and access of commodities, and financing and policy requirements. So really, and I won't read through each one of these here, would point you towards our detailed methodology and results on our website, but really reaffirming and reestablishing what the key informants qualitatively expressed as key needs for operational research in the coming years for hepatitis B. One of the differences I would just express between the scoping review that we conducted and the more systematic review that Alex just described is that in our scoping review, we had a real look at operational research without necessarily having clinical outcomes or patient level outcomes. And in the systematic global review, we're really looking at the care cascade outcomes that Alex was describing. So included a few more studies in the scoping review that we conducted that then were included in the systematic review of which Alex presented there. With that framing and with that urgent call for action expressed through our scoping review, through our focus groups, through our qualitative interviews, and information that we were hearing from the WHO consultation in parallel, we conducted an expert workshop that we held in April, May of last year, actually, where we actually physically congregated with many of the people that you'll meet on the line today, as well as pictured here from around the world. We had operational researchers, we had academics, clinicians, clinician scientists, we had leaders from the HIV movement, we had the World Health Alliance, WHO, CDC, all represented here. So really a top-notch, robust group of people who have been thinking about this challenge over many years. The goal of the expert workshop, it was a 2-day in-person engagement where we set out to identify operational research priorities and key questions for research, which I'll describe in a moment, to actually match those to potential study designs and studies that we would consider high priority to be conducted in the coming years. We assessed existing and needed research capacities in LMICs and how to achieve those. And then finally, we had sessions and panel sessions looking at opportunities and challenges for national policy and program engagement. And I'm going to give you a taste of those here on the next slide, once you can advance. But I'm also going to give a bit of a cliffhanger to the panel discussion that we'll have with many of the researchers who attended the workshop and can speak to this in their firsthand experience and why they expressed and prioritized some of these key areas. So the 4 key priorities, go back one slide here, just to give an overview of the key priority research areas for operational research that came out of the workshop. Priority 1 was really around simplifying delivery models to assure decentralized, equitable, and integrated access to hepatitis B testing and treatment within primary care or basic health systems in LMICs. So a large bucket there, and one that we'll dive into a little bit more in the next slide and through the panel discussion. Priority 2 is really around improving interventions to eliminate mother-to-child transmission of hepatitis B that protect the health of both mother and newborn. So looking at the family as a unit and not necessarily simply the vertical transmission of hepatitis B. Priority area number 3 was developing and operationalizing technologies for simplified hepatitis B diagnosis, treatment, and monitoring, an area that came up quite strongly in many of the qualitative interviews and focus groups, and one that we'll describe in further detail here. And then finally, priority area number 4, which was a bit different than the other 3 priority areas, but really looking at how can we detect persons living with hepatitis B at highest risk for progression of fibrosis and development of long-term outcomes, sequela of hepatitis B, including hepatocellular carcinoma. So with those 4 key priority research areas in mind, we'll go to the next slide. And I just wanted to give you a taste of what those specific research questions looked like. You can see this in the report, and I hope you can follow along with the 4 priority research area tables that we've assembled that you can see on the left side here, which really lay out potential design options that were put forward by the workshop members and some estimates of what it would take to accomplish those research studies. So is it a short or longer timeline? Would you expect outcomes, in the 1-year time horizon or even up to 5 years? What kind of cost, generally speaking, might that study entail based on your experience? And then finally, the potential impact that conducting such a study could have. And you can see some of those assumptions there at the bottom of the table. You can advance for me, Quincy, and I can just describe one of those key research questions for each of these research areas. Within the first priority research area, which was really around decentralizing and simplifying care models for hepatitis B within primary care. One of those questions more specifically is how can hepatitis B testing and treatment be effectively provided by non-specialists at different levels of the healthcare system? So that's really looking from community to health centers to district hospitals to regional hospitals where hepatitis B care delivery is not often found in LMICs. And participants of the workshop expressed different ways to address that question. primarily around observational studies and implementation science here in the middle row, setting up observational studies where key interventions to task shift or decentralized care could be conducted and evaluated over time. Next slide, please. So in the second priority research area, and you can advance the slide here, one of the priority research questions was around how can maternal hepatitis B surface antigen screening be integrated into antenatal care with other screening tests potentially, really looking at triple elimination of hepatitis B, HIV, syphilis, and other STIs. This is an area that speaks loudly from many of the researchers that we met from the field, really looking to do this in their own setups. And again, thinking about ways that both formative research, really looking at what are some of the challenges and needs in health systems from both the provider and patient perspective in antenatal testing and screening, as well as rolling out potential multiplex testing or new strategies for bringing rapid diagnostic tests at the point of care for antenatal care through implementation science and observational studies in LMIC settings. Next slide, please. You can advance again. So for the third priority research area, again, is around developing and operationalizing technology for hepatitis B. One of the key areas that's discussed quite often, and to be frank, came up in the literature more often, was looking at point of care testing technologies, both in terms of new testing modalities that might be available, as well as operationalizing existing point of care technologies in the most desirable, feasible, and effective ways. And here, we heard from many researchers about formative research using surveys and interviews for both providers and patients, as well as validation studies, both retrospective and prospective, looking at rolling out, demonstrating the feasibility of rapid testing and evaluating the effectiveness of such testing, not only in terms of comparison to gold standards, but also in terms of improving testing coverage within their health-seeking populations. Next slide. Finally, in area number 4, in identifying people at highest risk for hepatitis B progression to sequelae, severe outcomes, and hepatocellular carcinoma, setting up long-term cohorts, either prospectively, which might take much longer, as expressed by many of our workshop participants, but also pooling, aggregating, and establishing better data monitoring systems for existing information that can be gleaned from case control trials or retrospective cohorts. And Dr. Haile Michael will be speaking to this a bit more through some of the work that they've been doing in the African setting. That can speak to these questions and some of the needs that they may have in the future going forward.